Subscribe and click the bell icon for the latest updates and notifications from the Indian Express.
It is not the time to rest. In Kerala also, we are eagerly looking whether it is increasing or not, and we are trying best to flatten the curve. Now it is increasing, and we are waiting how much people are coming from. It is not easy. It is not an easy job, but anyway, we have enthusiasm in our people. I have enthusiasm with my co-workers, my doctors, and my staffs. They are the real heroes. They are working in front of the virus, fighting directly with the virus, and with their enthusiastic manner of working, I hope that Kerala can win again. The slogan of Ardhram Mission is to make the government hospitals, public hospitals, people's friendly and also technologically modern, and also to reduce the out-of-pocket expenditure of the poor people, to attract more people to the public sector, poor people to the public sector. When we examined in 2016, 67% of the peoples were going to private sector for the treatment. Even though there is a primary health center in the panchayat grassroots level, people are going to private sector for the treatment. We examined this thoroughly and understood that our primary health centers are not in a proper way. Only one doctor was there, and up to noon was their service. And the physical structure also, infrastructure also was not so good. And we tried to convert these things. When we convert primary health center to family health center, we framed a master plan for the family health center. We studied about the general practitioners system in UK, that NHS, and also we studied about the family doctor system in Cuba. And we have a very good discussion here with the experts and scientists and doctors. And we framed a project for family health center. We instituted what is the family health center. Infrastructure should be improved, and also the practices also should be improved. Every challenge is an experience to us. And in that NIPAH period, as you know, that is a newly emerging zoonosis, no medicine or vaccine. And we really afraid hearing that virus is NIPAH. When we inquired all over the world, only 4 or 5 places NIPAH occurred, only 4 or 5 places in the world, Malaysia, Singapore, Siliguri, etc. And we find out what they were doing at that time. But we didn't get proper protocol out of that. Then we find out what happened in the Ebola period, what is its protocol. We framed our own protocol basing that things here, that experience here, and we have a very good protocol and also standard operating procedure and our way of action. From that incident, we came to know what is the goodness of the contact tracing. We started contact tracing at that time, and we had a very good team for contact tracing. We built a team for that, trained them. This time also, when the COVID-19 virus occurred, we implemented that thing here, our experience, contact tracing. That is the most important thing. We have some health workers, we are calling them our CIDs. In that way, they are tracing contacts, visiting the places and finding out whether they have any contact with the positive cases. And that NIPAH experience and also the collective work, that also gave a good result in the NIPAH period. That also we started this time also the collective work, giving some responsibility to our officers and checking whether they are doing in a proper way, and every day having a discussion and analysis on that. Every day we are giving new remedial measures, we are adding new things in our work, and we are briefing to the society everything. It is very transparent. We lock down that places properly, we can save the other places also. But locking down doesn't mean abandoning that place. If we lock down a place, if we close a place, we should have to supply proper food, medicine, and all the essentials for the poor people at that place. If we can do that, I think we can diminish the spreading of the virus. But it is a difficult thing. I am not saying it is easy. Here in Kerala, we are making the containment zones. If there are some positive cases in a village, we are declaring that as a containment zone, and we are not allowing entrance or exit from that village. But we are providing foods and all the other essentials to that village through our volunteers. We have 2,50,000 Sanadam volunteers, especially for this corona working, and we are supplying foods and other things in that village through these volunteers. That is the method. That is the only method to prevent the spreading of the virus. We cannot prevent the virus completely, but we can slow down. We can flatten the graph. People should have to some health behaviors, some habits, some responsibilities to break the chain. All the people should obey the advisories of our health system, that hand washing, wearing mask, and keeping physical distance, etc. That we have to do for a long period, maybe up to 5 or 6 months or up to 1 year, etc. How long this virus left here is here, up to that period we have to do some behavioral changes to contain this virus. That is the only method. Every individual is responsible. Every individual should show some responsible behavior, and our health is our responsibility. Everyone should think our health is our responsibility. My health is my responsibility. That is the slogan here. My health is my responsibility. We should have to invest more money to health. Our government should invest. In India government is also investing 1% of our GDP for health. We have to improve the public health system throughout India. We are in Kerala, we are doing that. But I think in some part of India, in villages, they have no proper hospitals, no proper doctors, and other facilities in the villages. For village people, they have no accessible healthcare system there. That is the most important thing. Every country should do that, to build up a proper people-centered, people-oriented healthcare system, affordable treatment for the citizens in India. That is the only way to tackle this kind of problems. Scientists are saying that there will be a second rise in June, July, etc. We cannot predict this kind of things fully, but we should have to expect that this virus is like that. And Kerala should also ready to tackle this problem at that time. Now we are teaching people that the virus is not going and it is not the end. it will stay here. We have to live with the virus. Maybe in June, July, there will be another hike in the virus infection. Now in the corona period, we are giving free treatment to each and everybody without any discrimination of financial position. We are giving free treatment. They are coming in our hospital. The positive patients are admitted in government hospitals, not in private hospitals. A few people were in some private hospitals, but 99%, 99.5%, they are in our government hospitals, and we are giving free treatment to each and every patients. And private hospitals are helping us for the non-COVID treatment. They are conducting some telemedicine system and also some mobile system, etc. In that way, under the leadership of IMA and other organizations, they are helping. And we are working together to tackle this kind of problem. Because of that, we started reverse quarantine system here. Means the old age people should not move outside, or if we want to quarantine anybody who is coming from outside, we are not allowing to mingle, or we are not allowing them in the houses where there is old age people. If it is a big house and a separate room, separate bathroom, toilet, etc. Now we are insisting strict room quarantine. Don't move outside and don't try to meet the old age people. And by phone call, we are insisting the old age people also don't try to keep contact with the outsiders. That and also our Anganwadi workers and helpers got training, and we give training to them. And our Kudumbasri workers also, they are calling the old age people. We have a very good list in each and every panchayat who are the old age people, and we are calling them each and every day and insisting them to keep away from the virus. And if they have any problem, any health problem, they are addressing. And if they want to go to hospital, we are taking them to hospital. If we are not able to move outside, doctors are going to their houses and examining them. And we are giving everything. We are giving every attention to the old age people. And we are supplying the non-communicable disease medicine, NCD medicine for diabetes and also for hypertension. We are giving the medicine to their doorsteps.